Good morning, students. I'm Dr. Mansi, reader in Department of Pediatric and Preventive Dentistry, and today I'm here to take a lecture on special child, and this will be part 1 for it. This is a picture when special child is depicted. Judging a child who has special needs does not define who they are, it defines who you are. The content for this particular lecture will be introduction, definitions, classifications, and we'll be dealing with cerebral palsy, the etiology, classification of cerebral palsy, spastic type of cerebral palsy, hemiplegia, diplegia, quadriplegia, dyskinetic cerebral palsy, the clinical manifestations, oral manifestations, management, and lastly, the home dental care for children with cerebral palsy. Coming on to the introduction, disabled. Disabled does not mean worthless. According to American Academy of Pediatric dentistry is an age-dependent specialty that provides both primary and comprehensive preventive and therapeutic oral health care for infants and children through adolescence, including those with special healthcare needs. So why am I putting here the definition for pediatric dentistry when the lecture is on special child? Because if you read the last line of it, special healthcare needs. So pediatric dentistry is not only about the normal child, it is about special child also. The term special needs is a catch-all phrase which can refer to a vast array of diagnoses and or disabilities of children. Hence, the term children with special needs is for children who may have challenges which are more severe than the typical child and could possibly last a lifetime. Children with special healthcare needs comprise an expansive section of society encompassing children living with chronic physical, cognitive, communication, and behavioral difficulties. More than 1 billion people, roughly 15% of the global population, are recorded as having some sort of disability or special need. Of these, there are an estimated 93 million children aged 0 to 14 years who are living with moderate or severe needs. Of these, 13 million children suffer severe difficulties. For people aged 15 or over, around 892 million live with moderate or severe needs, with 175 million living with severe difficulties. Now, disability is the functional limitation within the individuals caused by physical, mental, or sensory impairments. Handicap, as by Murray and MacLeod, is the loss or limitation of opportunities to take part in normal life of the community on an equal level with others due to physical and social barriers. The Developmental Disability Services and Facilities Construction Act, given in 1970, it states that defined developmental disability to include people with mental retardation, cerebral palsy, epilepsy, and other neurological conditions closely related to mental retardation, which has originated prior to age 18 and constitute a substantial handicap in the year 1975 amendments. As per Weddell, that is McDonald Lavery, a disabled child is one who has a mental, physical, medical, or social conditions that prevents the child from achieving full potential when compared to other children of the same age. Disabled includes all handicapping conditions or combinations thereof that of a health professional might encounter. WHO, as per WHO, defines a handicapped individual as one who, over an appreciable time, is prevented by a physical or mental condition from full participation in the normal activities of his age group, including those of a social, recreational, education, and vocational in nature. American Disability Act of 1990, an individual is disabled if the person has a physical or mental impairment that substantially limits one or major activities, life activities, has a record of such an impairment and is regarded as having such an impairment. As per AAPD, that is American Association of Pediatric Dentistry in 2008, it can be defined as a person should be considered to have a dental disability if pain, infection, or lack of functional dentition leads to restriction of nutritional intake adequate for growth and restriction of nutritional intake adequate for growth and energy needs, delays or otherwise alters growth and development and inhibits participation in life activities. Special healthcare need is defined as any physical, developmental, mental, sensory, behavioral, cognitive, or emotional impairment or limiting condition that requires medical management, healthcare intervention, and/or the use of specialized services or programs. The condition may be congenital, developmental, or acquired through disease, trauma, or environmental cause, and may impose limitations in performing daily self maintenance activities, or substantial limitations in a major life activity. Now the classifications. Frankenwinter, 1974, blind or partially sighted, deaf or partially deaf, educationally subnormal, epileptic, maladjusted, physically handicapped, defective of speech or senile. Agerholm, in 1975, classified as intrinsic and extrinsic. An intrinsic handicap is one from which the person cannot be separated, while external handicap is one from which the person can be removed. For example, social deprivation. Novak, 1976, physically handicapped, poliomyelitis, scoliosis, mentally handicapped, mental retardation, congenital defects. Examples are cleft lip palate, congenital heart disease. Convulsive disorders, the example is epilepsy. In communication disorders, deafness or blindness, systemic disorders, hypothyroidism or hemophilia, metabolic disorders, juvenile diabetes, osseous disorders, rickets or osteoporosis, and malignant disorders, example, leukemia. Gamble classified it as physically handicapped, monoplegia or paraplegia. Monoplegia, paraplegia will be taken further in the slides. Mental handicap, Down syndrome, sensory handicap, deafness or blindness, medically compromised, hemophilia or leukemia, multi-handicap, multiple handicapping conditions. Gamble has also classified as handicapped for dentistry or dental handicap. So handicapped for dentistry is children who falls into the above mentioned categories, and dentally handicapped are with oral abnormality, example cleft lip and palate, and disabilities may range from very mild to extremely severe. Now coming on to cerebral palsy, the first form of disability. Nelson used the term cerebral palsy to describe a group of non-progressive disorders resulting from malfunctions of the motor centers and pathways of brain. American Academy of Cerebral Palsy and Developmental Medicine describes cerebral palsy as a group of disorders of the development of movement and posture. So there is disorder of movement and posture causing activity limitations that are attributed to non-progressive disturbances that occurred in the developing fetal or infant brain. It is a heterogeneous disorder that may result from congenital defects, mechanical or chemical injury, and infection. The condition is subclassified according to the clinical findings. The motor disorders of cerebral palsy are often accompanied by disturbances of sensation, cognition, and communication perception, or by a seizure disorder. The etiology, there are 4 P's: prenatal, brain malformations, in utero stroke, congenital cytomegalovirus infection, perinatal hypoxic ischemic encephalopathy, pyelonephritis, and meningitis. In postnatal, accidental head trauma, anoxic insult, or child. Thank you so much.